Howdy and welcome back to the podcast. Today we have a new guest, yet again, Miss Priya. Priyanka?
Priyanka is my full name, but I always tell people Priya because it's easier.
Priya.
Priya.
Or Priyanka, whatever. The name is in the title, so if you guys would like to, you guys can look at it there as well. But Priyanka is a pediatric physical therapist and owns, what's the name of the company?
The Baby Bliss Collective.
And then what's your name of your podcast? And then bring that guy super close to your face.
Oh, thank you. My podcast is Move the Feels because actually I've rebranded the business a little bit. But when I first started, it was for women of color specifically to help their mental health. But because I'm a pediatric physical therapist, I was like, I should probably add in something to do with babies because I can help them too.
That is kind of your space, right?
Yeah.
So how did it start? How did you get started working specifically? And pediatric is kind of a niche kind of area, especially for physical therapy, not what most people think of as physical therapy. So how did you get started in that space?
I've always wanted to work with babies, always, like even in high school. And so when I went to college, I actually thought that I would go become a doctor and just become a pediatrician. And that worked for a couple years. And then I was like, oh, this is too long of school. And I thought, what other routes can I take to still work with kids, but just different capacities? And so then I ended up going with physical therapy because I really love that you can make a bond with these families. For my job, I work in early intervention as well. And so we're seeing babies from 0 to 3 years old, 1 to 2 times a month. So you're literally with these kids and their families for years of their lives. And so I thought that was really important to me to be able to have that kind of relationship. And I always moved a lot growing up. Movement was always something that helped me regulate a lot. And I did Indian dancing and all this just general exercise. And I thought it just makes sense to do physical therapy, and I have a portion of physical therapy that treats kids too, so it worked out. Yeah.
It is such a interesting, okay, what do we do at 0 years old that we need to correct, right?
Yes.
What's happening between these 3 years that requires a PT?
Yes. So I think of it in 2 ways. Some kids are just born with certain diagnoses that will need therapy throughout their life. So if you think of cerebral palsy, which is brain injury when they're born, and then Down syndrome, those conditions, really, those kiddos are going to have PT throughout their life. And if you get in as early as possible, the stronger they are later in their life. So that's one part of it. But the more I worked as a physical therapist, specifically in the neonatal intensive care unit, I realized so much of movement helps babies calm down. So I don't know, if you have a kiddo that's colicky, cries a lot, or you feel like you can't get them to calm down, there's so many little movements you can do to help them feel secure in their bodies. And so that's when I realized, wait, I should probably combine movement and mental health care practices and teach parents that you can do this stuff literally from day 0 when they're born.
So you're teaching people how to emotionally regulate from a very young age.
Yeah, day 0.
Using movement.
Yeah.
That's kind of amazing, life-changing amazing.
Yeah, I think so.
Have you been able to see any of your 0 to 3-year-old kiddos become older? What's the oldest, I guess, client that you would have now? Have you been able to keep up with them? Longitudinal study, you know?
Yeah, I wish I could do that more. But I moved because I'm from Michigan, then went to Arizona and Vegas. But I haven't seen that long of a time period. But in terms of research studies, it just shows if you use these movement patterns over time, it develops a secure attachment from the get-go, which is wild.
That's wild.
Yeah.
That's you can prevent, I would imagine, I don't know if you could say this really, but I would imagine anxiety would significantly decrease later on in age. Depression chances are significantly decreased as they get older.
Yes.
The relationship with the parents, and so more likely to be successful long term.
Yes.
A lot of pros here.
Yes. And it's through movement. I mean, you can always add in the emotional pieces, right? Of how you talk to your kids, but you think of your body, and a lot of anxiety is you're holding your shoulders up or you're forgetting to breathe. It's so much of it drops down into your body, even though you're also in your mind with anxiety a lot too. But if you can help your body through that piece, it's almost like a ground up approach of I'm going to teach my body how to relax. And then that will help my mind kind of get on board a little bit too. And then if you give kids these skills from 0 or a couple months old, they don't even know really what it feels like to be anxious because you've given them tools to help themselves in those moments of anxiety.
That's insane.
I know.
So what movements does somebody use at that young of an age to help with these
changes based on the age. So like, say they're like 0 to 4 months old. I do a lot of playing in side lying. So like instead of them on their back, they're on their side. And it sounds funny, but you do butt pats because deep compression really helps to relax the body. So you have 2 parts of your nervous system. There's the part that like makes you go, go, go. And then there's the part that's rest and digest. And so when you give them deep pressure or the butt pats, that helps their rest and digest part of the system activate. And it's such a simple thing.
What are butt pat? Like butt like
literally like say they're on their side and you're just patting their butt and it's rhythmic, it's deep pressure for them and it just makes them feel so relaxed.
How fun. I wonder who figured that out.
I know. I mean, people have been doing it for years. I don't think people realize it, but when you intentionally do it with their kids, even before they're upset, it just like preps their nervous system to be calm and to use that parasympathetic nervous system that they have.
Yeah. How fun. So that's 0 to 4 months. And then what about, what's the next age bracket? And do these specific age brackets have names?
Honestly, they don't. I just think of it in months. So like 0 to 4 months is rolling. 4 to 6 months is starting to sit. 6 to 8 months is sitting and transitioning in and out of sitting. 8 to 10 months is crawling, 10 months is standing, and then 12 is walking. So like that's how I break it up in my mind. Okay. But it depends on the kiddo too, because a lot of kiddos with Down syndrome are gonna be delayed in that process too. So I just treat what I see and help them get to that next step of what they need.
Okay. What are some common things that you see that maybe either a Down syndrome child or somebody with cerebral palsy might come to you with?
Yeah. I've noticed like, and I guess this is also for adults really, everyone is weak in their tummy muscles and their butt muscles. It's just what it is. I don't know why, but like, and so when you teach a kid to walk, you need those 2 muscles to work together well. And so a lot of my treatment is how do I get these muscles to work together in the way they're supposed to. So I do a lot of tall kneeling is the word we use, but just imagine yourself kneeling and then lunge positions for babies and having them play with that. Squats, which is kind of the same with adults. And I still don't think that babies are like little adults. They're definitely different for sure, but some of the treatment that we do is actually not that different. So that's one big thing kind of across the board for all kiddos. And then actually at my most recent job, I've worked with a lot of kiddos with autism and ADHD, or they've actually just experienced traumatic upbringings and have been in the foster system for a while. So I was learning and practicing how to use movement to regulate them. And so a lot of that was more like the deep pressure, but instead you're doing joint compression. So it's such a simple thing, and all of y'all can do it too. You literally just squeeze your joints and do like 10 squeezes, and you have these like joint receptors in your wrists that help your body calm down and activate that rest and digest part of your body. Such easy little things you can help kids with. Or
That's
you have
wild.
them, I know, or you have them like push a wall, because any kind of heavy work is going to also relax the body. Pulling like wagons or something that's like a little bit heavier for them, but not obnoxiously heavy. And then like carrying grocery bags, like having them help you do that. All these random little things that you just wouldn't think of help them feel regulated in their body.
So do these effects, like, can I maintain these effects as an adult? Can I go and carry something and also, or like squeeze my wrist? And
Think of like you doing personal training and strength training. It's kind of like that's the adult version of having kids carry groceries and help you carry the groceries into the house. Like we do it as adults as well, but they look a little different when you're working with kids.
For whatever reason, I feel like the mentality is, or like the I've never heard of that. Like the use for exercise in my head is like, well, yeah, it reduces anxiety and reduces to like, it releases these endorphins and these things. But I don't know, the way you're phrasing it, it's like, oh, this can it just changes my parasympathetic nervous system like immediately.
Yeah, and I will say everything's repetition, and that's like across the board for all ages. So like, if I have a kiddo with Down syndrome who's naturally going to be really weak and have like low tone, that kind of stuff, they need a lot of repetition for that to really stick. But if you do it a lot and do these really easy things a lot, your body learns how to calm itself down rather than, because I believe that we live in a society that's pretty like stress, go, go, go all the time. So the ability to teach your body how to calm down like consistently over time to help combat that, I think is so important for kids to learn.
It's ridiculously important. I mean, I think it would be nice to, I don't know if I have much movement when, or like these tactics when being used on me as a child, but I'd imagine it would help me a lot with my anxiety today.
Literally,
you know?
I was like, I mean, I don't ever fault my parents because nobody knew that.
Yeah.
Like, I think this is a thing that has been up and coming for the last 5 to 10 years. And even now I'm learning constantly more and more about it to use movement for emotional regulation purposes. But truly, it would have helped a lot. And then the other piece is like helping moms do this, because just like you said, we may not have learned that in the 90s growing up, you know? And so helping moms who are new parents to learn how to use these tools to calm themselves down too is huge, because babies model what the parents do, especially mom, because mom's just with them all the time a lot. Or even in those first couple months, mom and baby are really, like, what's the word? They're just together, you know? So if mom knows how to really stabilize the nervous system and calm herself down, baby just feels that and then models it naturally.
So then are you working with both mom and child whenever you get maybe a new client, or like whether that be in the clinical system or now your own practice?
So that's what I want to do, because like in the clinical system, regular healthcare, I just worked with babies, but I was like, there's no point in me doing this if parents don't get it and they can't follow through, because I do get to see the kids a lot more than like you would in other professions, but it's still not quite enough for me to make a constant change unless the mom and dad get on board in some capacity. So like, and I'll try to make this as easy as possible for them. Like if they have a baby and I want them to work on like strengthening the tummy, I'll be like, okay, we'll work on rolling, but just do it during diaper change. You have to change your baby's diaper. So why don't we just roll them, put them on their tummy for a little bit, not even that long, and then just take them and go. You got to change these kids' diapers like 5 to 6 times a day. Like just quickly do the roll, and they're getting this repetition throughout the day to build that muscle up. So yeah, I try to make it as easy as possible, but at the end of the day, that's the other reason I like early intervention. It's coaching the parents, because at the end of the day, the kid responds to parents the best. I mean, I'm pretty fun too, but like they're going to listen and do what mom and dad say. For the most part.
Especially mom.
Yeah,
like,
especially mom.
Dad isn't around, or like the connection to dad is like, it kind of doesn't matter for the first, like, I don't know, there's a certain amount of time.
I think it's different. You have to like actively be there, but like if you're breastfeeding your kiddo, like that is a close relationship you're going to have with the kid that dad just doesn't have. I still don't think dads won't be involved, but it's just different. And so I feel like if the mom, that's why I want to work exclusively with moms. Also just in general, like, helping women's mental health is very important to me too, just because sometimes that gets pushed off. Or as women, we've been taught, let's caregive and nurture everyone else, but not ourselves. And we're living in a cool time where women are starting to realize that. And so I want to be able to provide services that help it be easy to take care of themselves quickly.
Have you ever, like, I think sometimes people are motivated to go down this mental health path for multiple different reasons. They either see people that have struggled, or maybe they struggled themselves in some sort of way. What motivated you to move down into the health, like the mental health space, and connecting these two things?
Oh, yeah. If I'm being honest, it was my own mental health struggle. So like throughout my 20s, I was in PT school, and in general, it was just hard. And I don't know. I think my family also has a history of depression, anxiety, so it's genetic for me. And so throughout life, I just really had to be on top of it. And honestly, for a long time, I was not on top of it. And I just like let life happen to me. And I'd say honestly, in the last like 4 years, I developed honestly a movement practice that helps me a lot. And then I also recently found out that I need to do things that really, really relax my nervous system. So for me, lately, it's been the sauna. And I just sit there for 40 minutes and I just don't think about anything. So on top of the exercise that does release the endorphins, it's still stress on your body, right? So I really needed something that would just completely zen me out. And so that's kind of how that journey came. And I used movement the whole time, like to help me combat depression and anxiety. And it really helped a ton, to the point where I was able to get off meds and like as long as I consistently went to the gym, I could have a handle on it. For me, it was like I learned every 2 days. Like I have to go to the gym every 2 days or depression, anxiety gets me. And I was like, I'm sure there's so many other women in the world who experience this too. Maybe even if they don't have a genetic component, but just like life gets stressful. And so the thing I developed, it's called intentional movement. And it's a combo of identifying the emotion, figuring out where it's in your body, and then doing 3 different exercises for that body part. So that way you're building a mind-body connection, but to that specific body part instead of more general. And then, have you heard of EFT tapping before?
Educate me, please.
Oh yeah, no, it's awesome too. It's actually used for research-wise, it's used for PTSD for like veterans, but it's so easy. It's just like tapping your head and going side to side and down. And honestly, I think it's harmless because you're literally just tapping, but that's the end of what I do to rewire the body and make a mind-body connection that's accepting the anxiety because that's a real part of us, but also moving through the anxiety so that you don't have to constantly experience depression, anxiety all the time.
That's really fun. I think if I look back on my past as well, I definitely have especially during my 20s, a lot of anxiety. I got diagnosed with depression whatever point. And I got on medication and I started taking Wellbutrin and I had like the worst experience in the world. I hated it.
Same, like you felt like you're just like apathetic nothing. Oh, that's how I felt.
I initially had this like really like crazy sense of like euphoria, and for me that's not great.
Yeah.
So I ended up abusing Wellbutrin, and then when I got off of it, I was like, okay, I don't think this is good for me. I gotta quit. I got off, and then had this like really hard swing all the way back down, where just I was like I'd cry for no reason, or I just like I was at work and like something minor would happen, and I would get so sad or frustrated. And then I was already at that point suicidal, and so like that didn't help the entire process, and so I did not have a good time on medication. I also didn't really like the willingness for somebody to just say like, hey, you can just take this pill, and like after 5 minutes of a conversation, I was getting prescribed Wellbutrin. It's like this is kind of crazy.
Yes.
But
without really looking at the effects of how that will affect overall your psyche. That's wild. I'm just also curious. Did you like go back to your doctor and be like, I got off this and now I'm feeling suicidal?
No, I stopped going entirely.
Okay.
Yeah, I stopped going.
You're like,
entirely.
this is not working.
It's not
I
working.
can't help be helped here.
Surely there's other. There's something about taking something that where I just don't necessarily feel the most comfortable. Like, let me see what other areas of my life I can change. And so, am I sleeping well? Am I drinking a lot? And am I using drugs? And if I'm doing those things, then maybe I should stop doing those things and then figure out the next step, right? So, like one variable at a time, rather than just like, here's just this other thing. It should fix everything else.
Change it all. Yeah. No, and I'm a big proponent of that too because, like, I honestly use food. Food was my like emotional crutch. There was definitely years where I experienced binge eating and just constantly ate so that I wouldn't have to feel that anxiety and depression. But then I went on meds, and honestly, I'd say I used people too, like to emotionally like think about them rather than my own self. I feel like so much of anxiety and depression is like, how do we fix it with something outside of you when there's so much you can do that is inside of you and in your control? And we like forget about it, or maybe we're not educated to use those things. But like EFT tapping, a lot of people I talk to don't know about that, and it sounds funny, but like every time I do it, I get relief. So if it works in my head.
Like, yeah, 100%.
And it's such an easy thing to do. So why is that not being given over medication or with medication?
With medication, I understand that some people like there's a need for medication,
for sure.
But also, can we prescribe an EFT tapping?
Yeah.
Or
sorry, it's emotional freedom technique tapping.
Emotional freedom technique tapping. So EFT tapping, or we were like prescribe a workout, like go walk. I don't know, go outside and go for a walk, or a sauna, or all these other options that maybe would be better in conjunction with, rather than just the drug on its own.
Yeah, I always think, so in physical therapy school, which is now like 8 to 10 years back, the way that they taught us was we focus on 4 parts of the body: your muscles, your brain / nervous system, your heart, and your skin. Weirdly, your skin. So I guess your skin is like the biggest organ in the body. So that's why they did that. Not once were we taught how could we treat depression and anxiety when literally our job is to help move people. That makes no sense to me. And I actually, now that we're talking about it, I'm like, I need to like just go to PT schools and be like, hey, have you thought about this? Because it when I think about it, I'm like, we should really be treating it. And like people should come to us and personal trainers, just people who allow you to move, to treat anxiety and depression. Because it sounds like it's helped you. It's definitely helped me.
Definitely have helped me. I mean, there's times where I was just like, I just need to go for a run. I need to get out of the house. I need to go do this thing. I had to come back and I'd feel so much better.
Yes.
Or go for a walk. It was a 30-minute walk with my dog or a jog or whatever it was. But if we do know that like movement is good for mental health, and then especially
and there's so much research for it.
So much research. And then you have people that are coming to you that if they can't move, like let's say I have a patient who has maybe a traumatic injury to their hip or their knee, and they have a replacement or whatever it was, and now maybe they were moving well before, and maybe they can't move now. If I'm going to think about an athlete on the extreme level, like their entire life changes, whether an athlete or not really. I mean, it's tied to their business as a professional athlete, but a general population individual, they come to you with a torn knee and now they can't pick up their kids, or maybe they need help getting up and down off of like to go to the restroom, like the pretty depressing things going on in their life. And you're like, hey, we can help with this, like, on multiple levels. We can just do movement and helps you on multiple levels.
Yeah. But then you're also adding the component of you're working with this person over such a long period of time. Yeah. It's just natural. They're going to talk to you about how they're feeling about all these changes. And you are in this unique position where you're like, I can help change your mindset here so that you don't have to think this sucks so bad. And how can we find different ways to help you move through this? That was another thing with PT school. I was like, nobody told me that I was about to become a therapist in the process of becoming a physical therapist at the same time. But I'm not a therapist, you know? Like I was never given that education, but I'm put in this scenario where people really divulge a lot to you because you're spending so much time with them. Yeah. And you want to be able to help them in the way that's unique to them. But I mean, this would be a cool area to study, but like I was not taught the therapeutic techniques to help with therapy per se, even though we're put in that position a lot.
I think I had a really cool opportunity with a therapist that I was seeing, and towards the end of our time together, we had more conversations on how to deal with people as a trainer. Like, how do you deal with these conversations? And he gave me like a lot of like tips and tricks, and like this is what they teach us in school. So I kind of got like a small education on, okay, this is how to be an effective therapist. And have good conversations to get somebody feeling a certain way, or to kind of lead them in a direction that would be beneficial for them. Yeah. And I was like, this probably breaks rules inside the talk therapy rules, whatever those are. But I am super appreciative of the fact that he did it, you know?
Yeah, because that's important to know when you're with people for that long. Like, because I'm assuming you see clients, a few times a week?
Yeah.
Over 3 to 6 months?
Oh, longer.
Or longer, exactly. Yeah. So, like, you're in their lives.
100%.
So that's awesome.
You have the opportunity to create such good relationships, especially with kiddos. Like, I don't know if they get to remember you, but I feel like you have an impression on, like, you get to see them grow. And like, even though they may not know it off, like, oh, that's the person that helped me like realize how to do these movements. Yeah. You can see them and you're like, hey, remember, like, you don't remember, but I remember I worked with you.
If they're older, they totally remember.
100%.
My 0 to 3 babies, they don't, but it's been funny where their siblings do, like their older siblings, and they'll be like, where's Miss Priya? And I'm like, oh no.
It's a good feeling though.
Yeah, it's amazing. It's amazing.
You're doing good work, obviously. If people can remember, like, oh, this is a person that helped me with that. That's pretty, it's pretty fantastic. Do you ever help with like the nutrition side of things as well? Or is that not really your space at all?
That's not really my space. Yeah, I would refer out for that kind of stuff. But I think over the years, for myself, I've learned what is helpful to help me feel good. But nutrition is interesting where it's so unique to the individual and what their gut looks like. So I don't have the training in that, but it'd be cool to learn.
I didn't think so because I mean, physical therapy versus personal trainers. I feel like physical therapy, you really get the opportunity to just like do your job versus like, I don't know, personal trainers. It's just like you have to like there's an expectation you do all these things, which is like, I think unfair to some degree, but or kind of ridiculous. But I think it's important to refer out, especially when you like have such a cool skill set of working with pediatricians or being a pediatric physical therapist, and then you can kind of like refer out to other people. I think it's super important.
Yeah.
What comes up next for you and how you want to continue to treat people?
Oh, yeah. Honestly, my biggest thing is I love not just to treat moms, but I really do have a soft spot for women of color because there's a certain generational trauma that happens with women of color specifically that I just talk to a lot of women and I'm like, we all have very similar stories, especially if your parents were immigrants and then they came here kind of thing. So I would love to work with, all women, but like a lot of women of color to help them if they want to help their emotions and not use like passive aggressiveness or yelling to communicate with their kids because that might naturally happen. A lot of times when you have your own kids, they trigger you. This is what I've noticed with like families. They trigger you because like they're like kind of mini yous in a little bit and they bring out the parts of you that you didn't see yourself. And so people tend to revert back to how they were parented and they do that to their kids. So I think you have to be very intentional unless you want what your parents did, with you growing up. But if you want something different and you're aware of it and you want to figure out how to do it, like that's like, I would love to work with women in that capacity. And I will always work with babies. I love babies, but I really am a firm believer of like, if I can help the moms learn how to take control and autonomy of their mental health without having to use a ton of medication like they can constantly feel confident in themselves because they know what to do for themselves in a given moment in terms of movement and mindset. Like the babies will just follow. Like the babies will just model it. So like I feel like 3/4 of the work would be working with the moms and the women of color. And then whatever kids they have will naturally be positively impacted by that. So when I work with moms, my goal is to do the intentional movement practice I talked about earlier. And then with babies, it'd be like pediatric PT, but also a emphasis on the emotional regulation part and using movement specifically to regulate their nervous system.
How fun.
Yeah.
You have kind of a complex
Oh my gosh, I know.
thing going on
I'm
there.
trying to learn how to make it more simple, but it's like a 2-part system.
I think it's a good system. I think it's an important system. Like they have to work, like they work together. I want to see more moms being able to like use that as a service. 'Cause I don't know how do you get your name? Like how do you educate more people?
I've been going to a lot of like networking events in Vegas and I have found a couple clients who they're just aware of it. Cause there's some people who are not aware that like they grew up with parents that maybe yelled to repair their relationships with each other, right? Like, and they just think that's normal, or that's just how it was when I grew up and that's how I'm, like, they don't think about it too much.
Yeah.
And so just finding spaces where people are a little more emotionally aware of that situation and they're like, I want to make a change in the best way possible.
I see some stuff coming out on social media. This is kind of a change of direction a little bit, but I just had a thought about pediatric chiropractic.
Oh my gosh, yeah. There is this physical therapist. Her name is her like username is Connective Kids. I think her name is Emily. And her baby, she's a PT, and her baby was not crawling. And she was just getting so frustrated because she's like, I'm a PT that works with kids and I can't get my baby to crawl. And then she ended up working with a chiropractor, a pediatric chiropractor, and now they have this whole business model together and they're just doing amazing things. So it's so weird because in PT school, they were always like, no, about chiropractors. But my thing is just safety, like making sure people are safe. So like, because in my head with babies' little necks, like that's my only.
That's scary.
Yeah. Because I have had, not a lot, but I have had like adult patients who had gone to the chiropractor and then they had a TBI and I saw them in the hospital and I was like, oh no. So that would be my only thing. But like Connective Kids, I follow her kind of religiously as a PT to get a lot of exercises and things like that. And her model has worked with like really well for the kids she's seeing. So I think everything is a little more like nuanced, like I'm never going to say like no to chiropractor or yes for sure, but whatever will work for that individual in a safe way. Yeah.
What's scary? I get so worried about the thought of a chiropractor going to a kid and like popping bones at such a young age. Like it's just, it seems like a no-go for me, like on the front end, but I'm sure obviously there's some value to it. I get worried. Like I'm sure there's other ways to correct whatever's going on outside of like this popping thing.
Yes.
And I think it's really interesting that they tell you no to chiropractors in PT school.
Yeah, they're very much like, this is not evidence-based. And they always said no. So that I also think was the key component when I was watching Kinactive Kids. I was like, this is so unique because they literally told us in school, like, don't refer or like work with them really. So I don't know.
My uncle's a PT and he worked with inside the clinic of my cousin who was a chiropractor.
Oh,
and it seemed like it was I thought that was that's how it always was. I've never heard of doctors like inside of school, doctors being said like, no, don't go to those other doctors. Like that's kind of
specifically
insane
chiropractors though, because there's a huge push for evidence-based practice, which I also agree with. But then like EFT tapping, there is evidence, but then it's also not super evidence-based. But I've never had a time it didn't work for me for my mental health. And in the same avenue of like, I've gone to doctors, I've gotten medication that didn't really help me. At this point, I need to figure out for me what is going to help me because these external things are not. So yeah. It wasn't like hardcore push, but I do remember like being told that and I was like, oh, okay.
I don't know. I like on the outside and like I would assume most like Gen Pop has a perception, or not even just people just in general have this perception of chiropractors is not in the most fancied way, and it's interesting to hear that it's even within the community at the academic level, people are having this same like conversation. It's wild.
So interesting. But then you had your uncle who worked with a chiropractor too.
Yeah.
So I don't know, maybe how long have they been like out of school / in practice? Because I think as you practice as a professional, you change how you look at things versus right when you get out of school.
They both have been out for like 20 plus years.
Yeah.
They've been out for a while.
Yeah. So you see some of the things that don't work in healthcare, and then you start to think clinically, okay, what can I do that's new that will also help people because this certain old way isn't completely working for me as a clinician.
How does insurance work inside of your
that's a
field?
Good question. Honestly, I want in my field or in the business?
In the business.
In the business, yeah. I want to do cash pay because I don't think insurance will quite pay for the things that I'm trying to combine all together. Usually insurance pays for like strict PT or strict like when you are going to the doctor. It's very like straightforward. And the thing I'm trying to do is not only like do physical therapy practices, but I'm really trying to combine it with the movement component. Because like even for myself, when I've gone to therapy, a lot of it was mindset. It wasn't drop down into the body. And so I haven't really seen insurance take that kind of combo together. If they do, I would take insurance, but for now it'll be cash pay.
And then how does it work inside the industry? I would imagine because it's so kind of strict that in my head I thought there was like you can only have this amount of like minutes per clients. Like you can only and that seems kind of insane to me.
Yeah. So like the way you bill is there's therapeutic activities and you bill for 4 units, which is 53 minutes. Like it's so specific how you do this.
Why is that? Why is it that number?
I don't know. So like it's so silly. There's an 8-minute rule and each 8 minutes is 1 unit. And so they go off of that. But again, it's like so randomly specific and doesn't actually make sense. And for me, it's like for example, I worked with a client recently. We did 4 sessions. Honestly, she had everything down by 2, but we went for the 4 so that way she like had it solidified in her mind. And it was so cool because I was just working with mom for those 4 sessions. And on the last session, she goes to me, she's like, my daughter, who I think she was a teenager, was having a really hard day and she just kept crying and I didn't know what to do. So then I used like the last part of intentional movement on her and she started to just like relax and calm down. And I was like, wow. This is why I'm doing this moment right here. And that like, unfortunately, I can't get that paid for by insurance yet. Who knows? Like maybe insurance will change down the line where they will see the benefit of using movement for mental health care, but it's pretty like separated and boxed out to what they think it should be.
I hate it.
I know. I do too. Do you take insurance or personal training?
I can take HSA, but I can't take.
Oh, okay.
Yeah. So I mean, the way that I was told to go about it is I can take a program and then I can get that program independently researched through a university, so I can get some academic research to support a specific type. Like this 8-week program will yield these results, and then we had the specific question of like osteopenia or something. So we're answering that question if it slows down or whatever, right? And then once we have that foundation of yes, this program solves this thing, then I can now submit to insurance that specific program, and then they would pay for that thing to get done. What I think was really hard is that if I have a client who maybe like they're not either showing up, then I don't get paid through insurance. Or what if they don't see the results? What if the diet is not okay? What if they're so far along that what if
there's so many factors.
There's so many factors that they didn't sleep very well the night before, so now our program has to change for today, or they're not eating very well because they're sick. And so now the results are like I need variance in the days at times, and I don't think that the insurance game would probably allow for that very much.
No, I will say peds is a different world because a lot of the kids I see, they need that physical therapy throughout their life. So we'd still set our goals and we work towards those goals, but there's this knowledge of like these conditions are lifelong, so the progress may change. Whereas I feel like with personal training, it's like, okay, we want to see a certain strength level happen by this amount of time. And now also, wait, so you have to do a study for your client, and then you get paid for that after, only if it works with the study?
So then I would take, let's say I wrote out a 12-week, or let's say we do a 1-year macro cycle.
Okay.
And then we break that down into all our separate mesocycles. So like, let's say we do every 12 weeks, and then we have to break down to a micro cycle. And so we're looking at every couple days or every week. So we have this whole plan laid out. We take a full study. So let's say we do 100 people at best. Like that's very expensive. But let's say we have 100 people. They all go through this program. We're tracking all these specific metrics, and at the very end, we can find that this macro cycle solves this issue. Now I can come to market and say, I take insurance, but you're going to be on this one program that was proved to be.
Oh, and then they won't pay it if you deviate from that program.
That's what I was communicated
That's
to.
Wild.
Yeah, and so
that's just not how humans work.
It's not how humans work. That's not the reality of training, right? And so. I would love to see me take insurance. I would love to see like more doctors refer out to using more of these things. Like if I had a client, we had somebody here, Invigor Medical, Derek, who is the CEO of Invigor Medical. They do weight loss and sexual health, and I feel like I'm missing something, but some other stuff. They do peptides, and so we talked about. A lot of people that are on GLP-1 or on these other trizepatide, I think is another one, and there's another one. There's 3. These weight loss supplements, they end up losing a lot of muscle mass. And so I think what would be super cool to see is to take that client who's on GLP-1, because now we found out that 1 in 10 people are on a GLP-1 item or weight loss item to decrease their likelihood, decrease the likelihood of atrophy by using a weight training program.
While they take it.
Right? So
that makes sense.
I'm slowing down the amount of muscle loss and then focusing on making sure that I'm actually losing, body fat, and I'm not becoming this like frail body. And so I would love to see that happen. I just don't know what the likelihood of that happening inside the insurance world and more on the private side, probably more likely.
Honestly, probably the private side.
Yeah.
And I have no idea when insurance will realize humans are malleable and they need rest, and they need also to be pushed, and you don't really know when that's going to happen. And that's okay. That's how we function. So, yeah.
There's a really cool sad fact. It was an insurance company that gave specific time requirements for surgeries so that you can only give anesthesia for that amount of time. That's all they would cover.
Is that recent?
It ended up not getting passed through.
Okay.
It happened for a little while, and then they stopped it, whatever it was. It got overturned at the end of the day. So let's say, getting your knee replaced. Well, the insurance says that should take about an hour. So you can do anesthesia for an hour. After that, we're not going to cover it.
That's crazy.
That's insane.
That's too much. That's too much.
Yeah. So it's really unfortunate. The perception of like insurance companies, the people that are making these calls aren't in the medical field, right? Like not a lot of the time. And some of them, sure, I'm sure that the people like they consult or do whatever. But how do you come to those rationalizations to tell someone you can only do surgery for this amount of time? You're this patient only needs 53 minutes because that's all we're willing to cover. I think that's rather insane.
Yeah, I think so too. Because I also feel like sure, there's like an average of what most people experience, but like you cannot put every single individual into that. And then I'm sure the people who are different than that average, they have to go through hoops and everything to get that paid for afterwards, even though they're in the healing process, which is already like tough on its own. I think that's part of my reason too for doing cash pay, because there's so much you have to think about with insurance versus like, let me just make your life so much better and let's change your life and put this like healthcare in your hands more so than this external, either meds or whatever the external thing is. Like, let's just put it into your hands. Like my goal with my business is I don't really want you to be with me for like a long, long time, because I want you to get how to help your own mental health and how to do that for your babies. I'll always be here if you need me, but like the goal is like, you don't need me. I do not want to be another external person that's you like use me as a crutch. Like you can do it on your own and I'll just give you some tools to help you do that.
I like being involved for a long time.
You do? Yeah.
I do.
Yeah.
I will give all information. I do not hold back. This is how I write a program. This is the breakdown of everything. But I think most often people are like, if I'm not scheduled, then I'm not going to go.
Ah, that's true.
And
it's an accountability thing.
It's an accountability thing.
Yes.
Yeah. So then I serve a different role in that kind of a space rather than like, it's not so much like, okay, I taught you how to squat, I taught you how to bend. Like I taught you to do all these movements, how to recover if you need to. This pain hurts here, so let's do this. We find out what works for your body. Great. And then they're like, all right, well, like I'll see you next month. Like, yeah, I'll see you next month. Right.
Yeah.
And it's also whenever something does like happen that's out of the ordinary, rather than being reactive or like rather than being so reactive where, it's weeks that we finally go see somebody for help. It's like something happened right now immediately. How do we change the program? Right. Yeah. So there is definitely some nuance to that.
And like, I guess now that you're saying that, I'm like, I mean, I guess how you emotionally regulate a teenager looks different than like a 7-year-old, looks different than a 6-month-old. So I guess in that capacity, it'd be cool to follow people. My only thing is, because I know myself, I relied so much on these external things to help, quote unquote, fix me. And I want women to feel like there's nothing that you have to fix. These are just tools that you're getting. Yeah. So in that sense, like I'd love to work with people long term, but I just don't ever want them to think like they need something else to help their mental health when it's always them who's like taking that action to help themselves.
You're in control.
Yeah. And like I want people to realize you're in control of your health a lot more than you think.
People are definitely much more in control of their health. I would 100% agree. I like the accountability part. And I also like, I needed help as throughout, like I had tutors during, I don't know that I had tutors during college, but let's say I did.
Yeah.
I had tutors, or like, more real. I had coaches during my time in powerlifting.
Okay.
And if I didn't have those people there, then I would have never probably had the success that I did, right? And they did follow me for long periods of time.
That's very true.
But I liked asking for help, and there's no way I would do it alone. Like, I need a banker forever.
Yes.
Like, I will always need that person.
Yeah.
Could I figure it out on my own? Maybe.
Yeah.
But then, like, having that person there who's always there as a support, I will always use a CPA. Like, could I learn how to be a CPA? Sure. I could go to school. I could do all these things, but like at the end of the day, it's not worth it for me to go and do all that stuff when I can just pay somebody to take
I actually
care
love
of
that.
thing.
It's actually like you're just making a team.
I'm
like
just making a team.
Yeah,
That's exactly it.
Actually, I love that. Actually, I'm changing my mind in this podcast. I do think it's actually important to have like, for women especially who, we take a lot out of like our female friendships and having very nourishing, supportive female friendships. You're literally giving me this idea of like, what if I made group coaching where for a certain age group, this community is for you. So you don't have to feel alone when your teenager is like running up the stairs and slamming the door on you and you don't know what to do to navigate that situation as safely as you can. Like that would be really cool to do. And you still have that team component. Oh, I like that.
You could probably travel with those people, like as those, like you're set in this age range, right? Like let's say that, I don't know, whatever teenage, like let's say 10 to 13, right? Mm-hmm. And like you have those set of moms that are within that age range. Like, well, all of them are going to be turned 13 to 16.
Yes.
And so they can travel through all together. Like, I feel like the more I talk to my clients at times, like we have really good friends with moms when my kids were in high school together, and then they all left, and then they don't have any friends anymore.
Oh, my heart. Yeah, that's so true.
It happens all the time. But if you I would imagine you have this like group that continues to like travel together.
Yes.
And if we look at Blue Zones, the number one thing that allows for long-term good quality health is having community.
Yeah, totally.
And so you can create, I don't know, some really, really nice communities from a very young age. I think we all need a team. Like in business, you need a team. Yeah. I think in life, we need a team.
I think so too.
Yeah.
Okay, you've changed my mind. I'm going to keep working with you long term. And just make it very clear to them that you can still do this on your own, but I'm just going to help you out a little bit.
100%. And like, but you have a specialty, you know? And like, they will never have gone through all the education that you have and understand like the nuance of when to change and when to like maybe speed up. But you are there, and like, I don't know, I think that's super valuable.
That is, and it's fun.
It's so fun.
Yeah.
And then you get to like really see those kids grow. Like I remember I trained kids for a while, and it was the best thing.
Yeah.
Like I had as young as 4.
Oh my
but
gosh.
Really the core of the group was like between 6 and 11. Okay. And then being able to watch those kids, like even just like months of like small little bits of training, how they interact with each other. Like they would start off by yelling at each other and treat each other like super terribly. It was called the Young Gentleman's Camp. And so we're going to be here to be gentlemen. And just watching them become like really kind of respectful. Like I'm going to pick up, like 6 months ago, I would have thrown the ball way far away and you would have like, go get it, right? Like bullying on each other versus like, I'm going to pick it up and grab it for you.
I love that. That's amazing.
The coolest thing.
Yeah.
I recommend.
Oh, yeah. And that's, again, you're building that community for young boys who need that too. That's amazing.
We had a young gentleman's camp and a young ladies camp. And so the young lady, I absolutely love the little girls. Like they were just, it was wild to like watch them, how they interact with each other versus the boys at the same time. Yeah. So you have this like, I don't know, you just, the way women interact with each other versus the way men interact with each other. And you can still
see that at such a young age. That's so interesting.
Yes. Yeah. And then you have them mix with each other and you're like, this is madness. I loved it.
That's awesome.
Where can people find you?
Ooh, so my Instagram is Baby Bliss Collective. And I'm on there a lot, honestly. But I also have a TikTok and email too. But honestly, Instagram probably, because that has like a lot of easy things that you can do for you and your kid, and easy tips that you can just literally do today.
And then the podcast.
Oh, yes. And then the podcast. It's called Move the Feels, the podcast. Honestly, I have to like go on there and do a couple more episodes because honestly, Instagram has been my like, let's just educate people as much as possible on the easiest things they can possibly do. Yeah. But I also have Move the Feels, the podcast.
Beautiful.
Yeah.
Thank you for coming on.
Thank you so much for having me. This is so fun.
Yes, ma'am. Thank y'all. Love you. Take care. Bye-bye.
Bye.